So you're at the end of your pregnancy and you're having all these prenatal cervical exams and you've got numbers and language that's been thrown at you and you really don't know what they mean. So here is your uterus. No, these are not ponytails. These are fallopian tubes. These are uterine ligaments that go around your uterus. And here is your cervix. We're going to pull away the sacral muscles and the cervical muscles, and please body balance because those need a good cardio workout during pregnancy also. But anywho, here is your cervix, and your cervix usually is tilted, posterior. That is super normal. It will come forward and go up and down. Sometimes that's outside of labor for prep. Sometimes that's during labor. But what has to happen in the last month of pregnancy or getting around your due date, or sometimes even after, your cervix will start to thin. It'll start to shorten and it'll start to thin out. You have to thin, that's the effacement, that's the percentage that everybody talks about. You have to thin out before you can effectively dilate. Now, again, this stuff usually happens in labor. When you are going to your prenatal cervical exams and you're getting all these numbers, this doesn't mean anything. It doesn't mean that you should be progressing if you are icing on the cake. But I hear everybody say, well, I didn't progress from week to week. Doesn't matter. You progress in labor. The opening is the dilating. That's the opening. And then when talk about baby station and when baby is descended, that's not really the terminology I would use. The station where baby is relative to your pelvis, here's about 3, baby still floating up here. Here's about 2. Here's where we get to about 1, and then here's where we get to about 0. Tracy, how do you know and how do they know? When they check you, these 2 bones right here in relation to your baby's head is where the station is. If your baby's is right here level with this bone, that's 0 station. 0 station usually doesn't happen until labor, especially if you're a first-time mom. But remember, all of this happens in labor. If it doesn't happen before, it's okay.